Hi. I'm robo-Suzie and today I'll talk to you about angina. Causes, symptoms and treatment. Also don't forget to subscribe for more tips in the future. But back to our topic. Angina is a term generally used to refer a kind of tightening sensation. However, there are many subclasses of angina and it all depends on the area, which is suffering from this kind of tightening discomfort. One of the well-known subclasses of angina are like Bowelgina, which is also called abdominal angina. There are also subclasses of angina, which are a threat to life. One such subclass is called Ludwig's angina, which is caused when the floor of the mouth is exposed to some sort of infection, or in other words, dental infections. However, although angina has many subclasses when looked in scientifically, generally, the term angina is commonly used to denote a subclass called angina pectoris. Angina pectoris is a serious pain that is experienced in the torso area or chest. Symptoms of angina. The symptoms associated with this disorder are quite difficult to distinguish, as it could range from heartburn or other kind normal chest pain to heavy heart attack. However, the good news here is that there are certain signs, which could be very much helpful in realizing the angina attack. Some people will have to face a big deal of discomfort although they are not subjected to face heavy pain. In common words, angina can be defined as burning or squeezing of torso area, torso tightening, heaviness of chest and choking sensation, etc. Usually, these feelings may last not more than 5 minutes. However, getting an ECG is the best option to identify angina pectoris. Looking deeper into angina, there are basically two types. The first type is called stable angina, which actually refers to symptoms demonstration after one has worked out his body with some exercises like lifting heavy weight and jogging, etc. Of course, the second type is called unstable angina. Unstable angina could be quite dangerous as it occurs without any kind of provocation. It is because of blood clots, which will be released from the blood vessels. In fact, angina itself is a kind of symptom of a heart disorder called myocardial ischemia. It is actually regarding the blocking, narrowing as well as tightening of the blood vessels. To be more specific, it is all about the arteries, which are busy in supplying the oxygenated blood to human heart. When the arteries are narrowed, the blood flow will be quite difficult. In fact, fat is said to be the main culprit usually causing these problems. Treatment for angina. The most preferred way of treating angina is aspirin. Aspirin has some blood thinning qualities, which will in turn make the blood flow easy and fast. Hence, the blood will reach all parts of human body. In addition, aspirin will also help to dissolve little blood clots, which are the reason behind angina pains. On the other hand, there are also some other treating methods like magnesium administration, which is usually recommended for mild angina. Magnesium injections are also used to treat severe angina cases. It is strictly advised to consult the family physician before going with any kind of treatment. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.